What if everything that you know about chronic low back pain and sciatica is wrong? What if you don't need to fix your core stability or stretch or fix the disc herniations or degeneration? What if you don't need hands-on treatment? What if you don't need to fix your posture or your muscle imbalances or your asymmetry? What if your scoliosis or spinal curves are not the cause of your back pain? What if rest was one of the worst things that you could do for chronic back pain and sciatica? What if these things don't matter and you're wasting your time spinning your wheels instead of doing stuff that does make an impact? Let's move past debating about who has the best method for back pain and sciatica and actually look at the research on the topic. When we look at the research, we see 66% of disc herniations heal on their own, and 96% of disc sequestrations, which is like a really bad herniation, heal on their own. So the worse the disc herniation, the more likely it is to heal on its own. But what if it never heals? Because in fairness, your disc herniation might never heal. And if that's the case, well, guess what? As long as there are no red flags like partial paralysis of the foot, numbness and tingling in the groin, like you can't feel it when you wipe, incontinence, loss of control of bowel or bladder, polyneuropathy, like numbness and tingling in all kinds of weird places, or fever, sweats, chills, changes in appetite, loss of hair, those types of weird symptoms, obviously get that stuff checked out. But if these things are not happening for you, then the disc injury probably doesn't matter, and there's probably nothing serious going on. And we have tons and tons of research on this. This is not my opinion. This is not saying, oh, my method is the best. The research clearly says that the disc herniations in most cases don't actually cause pain. Here's a study where we looked at over 3,000 pain-free people, and you would expect that if they have no pain, they would have a really good-looking MRI, but they don't. By 50 years old, 80% have degeneration, 60% have disc bulges, 30% have disc protrusions, and 23% have annular fissures. You would also see things like scoliosis, spondylolisthesis, and many other conditions in people who have no pain. So pain-free people have bad-looking MRIs. Disc herniations rarely cause pain. This paper showed that disc herniations actually only cause pain about 1 to 3% of the time. This paper showed that 90 to 95% of low back pain does not have an identifiable structural cause, meaning we cannot blame a single structure in the back for the pain, okay? We cannot blame the stuff on your MRI for your pain. So we need to stop stressing about the disc or the stuff that you saw on your MRI, because we know from research that fear of pain is more disabling than pain itself. Now, real quick, I'm Dr. Anthony Davis. I've got a ton of letters after my name, but I'll tell you my story in another video. The short version is I had chronic pain for a decade, and it was debilitating to the point where I needed to rely on drugs and alcohol. This is me passed out at the bottom of a staircase because I could not cope with the pain otherwise. I discovered a way out, became a doctor by understanding the root cause of chronic pain, which I'm going to teach you, and helped hundreds of people just like you to overcome chronic back pain and sciatica. So why is it that the standard treatment doesn't usually work for many people? Well, it's because a weak core. Oh, you got to fix your weak core. No, a weak core, according to research, does not cause back pain. Stretching does not prevent back pain. Guess what? You don't need fancy hands-on treatment because telehealth is actually just as good as in-person treatment. So what do those two things have in common? Oh, guidance, accountability, somebody to listen to you, somebody to design a program for you. That stuff is the important stuff. It's not about fancy hands-on treatment like massage, chiropractic, acupuncture, cupping, etc. These things feel good, but they are temporary pain relievers. There's nothing wrong with them, but they don't provide long-term stability, strength, and overall resilience of the body, right? So these things, core stability, stretching, disc changes like degeneration and herniations, hands-on treatment, fixing your posture, fixing your muscle imbalances, your alignment, your scoliosis, your leg length, your pelvic tilt, your spinal curvature, and resting, taking it easy. Oh, we better not push it. These things do not work. These things do not matter. And beyond that, I bet we're on the same page about medications, injections, and surgery. Again, these things don't matter. Here are 18 scientific studies, peer-reviewed research papers. I literally stopped quoting papers because I ran out of space. I could quote hundreds and hundreds of papers showing you that these things are not the cause of pain. Yes, in some cases, these can be a side dish to rehab. They could be a small part of rehab, but they should not be the main dish because they are not effective on their own. So how is that possible? I know you've been trained to think it's physical. My pain has a physical, tangible, damage-related cause, and if the thing is damaged, then I'm going to have pain forever. But we are not robots, okay? And when you understand the real root cause and the complexity, the multifactorial nature of chronic pain, and we start to zoom out and see the bigger picture and look at you like a whole human being rather than a collection of parts, then it becomes really obvious why things haven't worked so far and what you're missing and what you need to be doing for your back pain or your sciatica, okay? So I created a free training to teach you how to conquer chronic low back pain and sciatica. In that training, I'm going to show you 4 secrets to reclaim the active life that you love without relying on drugs, surgery, or complicated exercises. The training is completely free, so watch the masterclass. The link is in the description or a comment or a button that's appearing on your screen. Go watch that masterclass. It summarizes everything that I try to communicate in my hundreds of videos on YouTube, but I put it all in one place to guide you through understanding what causes pain and what do you do about it. And this training teaches you exactly the same stuff that I taught Joanna, who had chronic back pain, was really obsessed about, bracing her core and stiffening the spine. But once we got her loosening up, we got her into weightlifting and running and all kinds of amazing stuff. Or Ben, who now is able to really find and connect to movements that he finds joy in. Or Michael, who tried all kinds of things, 5 months of, physical therapy, massage, stretching. And then we were able to get him back to playing with his kids and going to the gym and feeling like a normal person. Or Kat, who had a bunch of surgeries, but we were able to get her to bounce back and do full body weightlifting. Or Jim, who we got back to golf and look, he's hitting the ball further than he was before the injury. I mean, look, this is the same stuff that I teach all of my clients, all of my patients. And if you want to understand and distill all of that wisdom and experience into one masterclass that's going to change your life, click the button, watch the masterclass, okay? Now, if you're still kind of like wondering, should I even, spend the time watching the masterclass, which is free, by the way, just put your email in and you'll have instant free access to the masterclass. But it's not for you if I don't want to waste your time. If you have fractures, if you have spinal infection, tumors, these are obviously things you need to talk to your doctor about. This is not going to help you if you have those things. Or if you have major red flags for nerve damage, like partial paralysis of the foot, saddle anesthesia, you can't feel it when you wipe, incontinence, loss of control of your bowel or bladder. These obviously need to be checked out by a doctor. And lastly, if you're not willing to think outside the box, then it's not going to help you. Okay, I could tell you the answer, I could hand you the answer on a silver platter, but if you can't think outside the box, then don't waste your time watching the masterclass. So I'm talking to the people who have chronic low back pain or sciatica, who probably have recurring flare-ups. You might not even really know why you have your flare-ups when you have your flare-ups. They just kind of happen, or they're up, they're down, left, right. You're having these flare-ups, you don't know why, they're unpredictable, they're uncontrollable. You probably have some mild to moderate disc-related issues on your MRI. You've probably had an MRI, you've probably done a bunch of physical therapy, probably some chiropractic, a massage, those types of things, and it hasn't really worked. You probably are the type of person that's like, I feel like I've tried everything, and I promise you, if you feel that way, just watch the masterclass. It's completely free, and it will show you, I promise, you have not genuinely tried everything, okay? And you have not tried a genuinely research-based approach. I break it all down in the masterclass. And this is exactly the same masterclass that all my clients have gone through, same training. I taught all of these wonderful people. So if you want to know how I help all of my clients and you really want to get to the good stuff, then click the link, hit the button, put your email in, you get instant access to the masterclass. And again, this is going to condense years and years of experience with hundreds and hundreds of patients with back pain and sciatica, and my own experience overcoming chronic debilitating pain, and teaching you in this deep dive masterclass exactly why chronic pain happens, what causes it, and what to do about it. So if you haven't seen the masterclass yet, what are you doing? Watch the masterclass, and then if you do want any additional help, if you want help to jumpstart your rehab, you do have the opportunity to book a free call with me. I don't know how long I'm going to be offering one-on-one consultations for free. So if you have even the slightest curiosity about understanding what causes pain, how I help my clients, and you want to actually get on the phone and talk to me, you have to watch the masterclass first, but as long as you watch it and we're on the same page, then I am happy to give you some time. And if you don't want the free call, then at least you walk away understanding the cause and what to do about it. So watch the masterclass and reclaim the active life you love. I'll see you on the other side.